If you've already been diagnosed with cancer, then you know firsthand that you never want to go through that experience ever again. Never. Dr. Amy here, and in this video, I'm showing you the signs that your cancer might be coming back. But here's the truth about cancer. There is always a small possibility that you could have a cancer recurrence. There is nothing that will 100% guarantee that you will stay cancer-free. So here's what to do instead. Know the signs and symptoms of a cancer recurrence so you can detect it as early as possible. This is the best chance at saving your life. But some of these signs and symptoms, they're really hard to detect because they're really vague, unless you watch this video. I'm showing you the signs that your cancer might be coming back. Starting with number 1, persistent pain. One of the most telling signs of a cancer recurrence is persistent pain. Whether it's a dull ache or a sharp shooting pain, persistent ongoing pain can be a sign of a cancer recurrence. Now, this does not mean that you should fall into a psychological downward spiral just because you have a headache. We're talking about persistent pain over weeks and months. But if you're the type of person that's quite anxious, then I want you to start by keeping a diary. Write down when you have pain. Document each time you have it and tell yourself that you will go and get it checked out if it persists for 14 days. Anything shorter than that is likely just a sore muscle, or maybe you're even just dehydrated. Okay, the next thing to look for is changes in your body weight. If you're experiencing unexplained weight loss or weight gain, this could be a sign of a cancer recurrence. Significant and unexplained weight loss or weight gain can be a cause for concern, especially if you've done nothing to change your diet or your exercise. Shedding or gaining pounds without even trying could be a sign that you're having a cancer recurrence. This needs to be investigated. Now, keep in mind that many things can influence your body weight. So if you went on vacation and you gained 5 to 10 pounds, it's more likely that you just overindulged. It's likely not cancer. But if you end up losing 10 to 20 pounds over the course of a couple months without changing anything in your diet and exercise, well, then this could be cause for concern. Now, obviously, with anything listed in this video, well, you know your body best. The healthcare professionals you come in contact with are brilliant experts, but you are the expert in your own unique body. If you feel that deep down something is wrong, you need to get it checked out. If healthcare professionals put you off or tell you that it's all in your head, well, you need to get a second opinion. You really owe it to yourself to take care of your body. Without your health, you don't have anything. You have a right to get your questions answered. Okay, and next up is a tricky sign that your cancer could be coming back, but you need to know about this one. Exhaustion. Exhaustion is a common side effect from cancer and cancer treatment. This is why it's such a hard symptom to detect by cancer survivors. But exhaustion after cancer, well, the good news is that it can be easily fixed. Many cancer survivors joined the Cancer Freedom Program to help get support fixing their energy, reclaiming their life. They want to go back to living, but they're just so exhausted. They're so tired that they have a tough time making it through the workday, and by the time they get home, they're exhausted, so they just sit down on the couch and relax. They have no time to spend with their family or friends, no time to do anything they enjoy. They feel like they're still missing out because of this cancer exhaustion. But in the Cancer Freedom Program, we can completely get rid of your exhaustion in as little as 21 days. Give me 3 weeks and I will give you your energy back. I've done it for myself and over 400 women in the Cancer Freedom Program. And now it's your turn. Click the link below in the description to apply. But persistent exhaustion could also indicate the return of cancer cells. They could be zapping your energy and your vitality. If you've done all the right things after cancer to reclaim your energy, but you're still feeling exhausted, well, then this might be something worth investigating. Okay, but next up is changes in your bowel or bladder habits. Any alteration in your bowel or bladder patterns, well, they should be noted. Whether it's blood in the urine or the stool, frequency of urination, or pain while passing stool or urine. These changes, they really warrant attention and examination. Okay, and this next one, it's a big one. You definitely want to know about this one. persistent coughing or difficulty breathing. A persistent cough or difficulty breathing, this is something that you should take seriously. Of course, it could just be allergies or a chest infection. All normal, everyday things. But it could also be something more serious. Many cancers can reappear as a recurrence in the lungs, and this is what can lead to a shortness of breath. We also know that some types of cancers, specifically ovarian cancers, can lead to a fluid buildup around the lungs. And this fluid could potentially need management or drainage. So if you feel like going upstairs or walking around your neighborhood is making you more short of breath than usual, well, then this could be cause for further investigation. Now, sometimes a persistent cough from something like a viral infection, it can last for weeks. It can take a long time for that cough to resolve, and this can leave you really not feeling like yourself. But regardless, if you have a cancer history, you want to get this checked out. Okay, and next up is noting any new lumps or bumps. Be vigilant about any new lumps or bumps that might appear on your body. Even if it seems insignificant, this could be indicative of a cancer recurrence. Trust your instincts and seek any medical advice if you notice any changes. Now, most of the time, lumps or bumps in your breasts, they're not cancerous. They're totally normal and benign. But the smart thing to do is to stay calm and get it checked out. It's not cancerous until proven to be cancer. Otherwise, it would be smart to assume it's just a lump or a bump. The best way to monitor new lumps or bumps is to document them. Now, of course, you're likely doing a monthly breast examination. Now, life is busy month to month, and you may just forget things. So the best way to monitor your breasts for any changes in lumps or bumps is to keep a journal of your findings. This may be as simple as a note on your phone or a piece of paper. If you use a pen and paper, you can create a visual of what your breasts look like and note where any lumps or bumps may be appearing. This practice not only helps you monitor changes in your breasts over time, but keeps you really in tune with what's normal in your own body. Being familiar with what is normal in your body, well, that's key. Knowing the difference between what is new and what is normal, well, this will help you get prompt medical attention. If you notice any lumps or bumps in your breasts, well, then note it in your diary. Then you'll know to check the same spot again next month. Now, if you do have a monthly menstruation cycle, then you'll notice changes in lumps or bumps in your breasts according to that cycle. The hormones of your cycle do influence this. Okay, but the next sign that your cancer might be coming back is a persistent headache. Headaches that persist despite over-the-counter medication or that are associated with vision changes, well, this needs to be checked out right away. If you had cancer in your brain or in nearby areas, then this could be an indication of a recurrence. Now, of course, most cancer survivors fear the most that they'll have a cancer recurrence and it'll come back in their brain. That feels like a death sentence. But I want you to know that even if that terrible scenario does happen to you, it doesn't have to be a death sentence. There are continuously advances in cancer treatment, and these circumstances don't have to be dire. Cancer can be treated and managed over a very long period of time. Now look, most of the time, a headache, that's not gonna be cancer. It's just a headache. Simple. But a persistent headache, it needs to be checked out. Even if it's not cancer, a persistent headache, well, that's no way to live your life. Go to the doctor and have it examined. Okay, and next is difficulties swallowing. Okay, difficulties swallowing or painful swallowing, that could be an indication of a cancer recurrence. Particularly if you had cancer in your throat or your esophagus, well, you're definitely more in tune with this. Any persistent difficulties with swallowing, it should be evaluated. But even if you had cancer in another site, this is something that you should note. Having difficulties or pain when swallowing, that's not normal. Most people won't have any difficulties with swallowing or painful swallowing until quite late in their life when they're really elderly, or if they have some sort of neurological damage like a car accident. If you're having difficulties or painful swallowing, then get it checked out. Okay, so now that you know the signs that your cancer could be coming back, the next thing you need to know is how to give yourself the best chance at staying cancer-free. Like I mentioned, there's nothing that will give you 100% guaranteed shot at being cancer-free, but there are some simple strategies that you can start doing today to significantly lower your risk of a cancer recurrence. That's why I'm linking up this next video for you here. Click the link here. I'll see you in the next video.